How to understand your pap smear results report. Imagine sitting in your doctor's office, waiting to hear what your pap smear shows. Understanding your results can seem confusing at first, but knowing what each outcome means helps you stay informed about your cervical health. A pap smear is a simple test that checks for abnormal changes in the cells of your cervix, which can sometimes be early signs of cervical cancer or precancerous conditions. It's a key part of screening and early detection, efforts recommended by health authorities worldwide. If your results come back as normal, this means no abnormal cells were found in your cervical sample. The cells look healthy and regular under the microscope. Sometimes, a normal pap smear also tests for high-risk human papillomavirus, or HPV, which is linked to cervical cancer risk. A normal result suggests you can continue routine screening as advised by your healthcare provider, usually every 3 to 5 years depending on your age and health history. If your pap smear is labeled as unsatisfactory, it means the sample wasn't adequate for a clear assessment. This could happen if the sample was obscured by blood, mucus, or if not enough cells were collected. In such cases, your provider will likely recommend repeating the test in situ for months to get a better sample and ensure accurate results. When results are abnormal, it indicates that some cervical cells look different from normal cells. This doesn't mean you have cancer, but it does mean further investigation is needed. Abnormalities are categorized based on how severe the cell changes are. For example, if your report says ASC-US, which stands for atypical squamous cells of undetermined significance, it's the most common abnormal finding and often caused by HPV infection. It usually resolves on its own or with close monitoring. LSIL, or low-grade squamous intraepithelial lesion, indicates mild abnormalities that often clear up naturally, but sometimes need follow-up. HSIL, or high-grade squamous intraepithelial lesion, suggests more serious cell changes that could progress to cancer if left untreated, so prompt follow-up is important. Other categories like ASC-H or atypical glandular cells, which line the cervical canal and uterus, may also be reported and requiring additional testing. After an abnormal result, your healthcare provider might suggest further tests such as HPV testing, which checks for high-risk virus types, or a colposcopy, a detailed examination of your cervix with a special magnifying instrument. Sometimes, a biopsy is needed to remove a small tissue sample for closer analysis. Mild abnormalities often requiring monitoring, as many HPV-related changes resolve naturally over time. Higher-grade lesions may need treatment to prevent progression to cervical cancer. Results usually take about 1 to 3 weeks to come back. Once you receive your report, your provider will explain what it means and recommend when to have your next screening or additional procedures. Regular cervical cancer screening is vital because it helps catch any issues early, when they are most treatable. Remember, each person's situation is unique, so always follow your healthcare provider's advice for follow-up care. Staying informed about your pap smear results empowers you to take proactive steps toward maintaining your cervical health and reducing your risk of cervical cancer.